Okay, welcome guys. This is a review of the roles of organisations in health and social care, particularly looking at all the different places in which care is provided and also the role that performs in providing care. Very similar to what you may have looked at in section A, where you looked at the professionals and their roles, responsibilities. This is kind of a parallel to that, but it's more about the place rather than the professional. So when it comes to health and social care in England and Northern Ireland, Scotland, Wales, there are four key branches of the NHS. So the NHS is kind of the umbrella organisation with little subdivisions focusing on each part of the UK. So obviously the UK is devolved in its powers, and obviously the NHS works in the same way. So essentially NHS Scotland, for example, prioritising on the health needs of Scotland, which are going to be different to Wales, to England, to Northern Ireland. So most healthcare settings in England are managed by the NHS. They will be broken down into smaller trusts that represent smaller areas, constituencies, particular types of hospital and locations. And again, they'll be run by people like governors, there'll be doctors, nurses, patients, all contributing to the way in which these services are run and provided. They'll be central to making individual decisions in an area, but generally they're controlled by a centralised NHS. The main NHS sets the goals, the priorities, the focus, the spending, but smaller areas can control how they use their resources. When it comes to healthcare, there are two kind of key branches to be aware of. You've got the public health bodies. So again, the NHS, GP services, these are often provided to the public to provide health care. So the health public bodies. Great Ormondshire Hospital is an interesting example of a public health body because it is a public healthcare setting. It is accessible for everyone publicly and freely, but as sort of the charity status also means they get money contributed through charity donations. Social care bodies are more about your council, and it is the social care element. So it's your child services, it's your adult learning support services, it's financial support, housing support. It might be resources to help people maintain their independence to live at home on their own. So these are the services that are provided by social care agencies. Now, if we break these public and social care bodies into two kind of roles, so the public health bodies, like the NHS Foundation Trust, they will run the hospitals. They provide mental health services, child health services. They will partner with other organisations to maintain a medical and kind of healthcare related focus in the people they serve. Local authorities do very much the same. They're serving the community, but this is more about the social care. It's non-medical. It's more about supporting independence, helping people live independently, and they will work with other organisations. So they will work with charities, they'll work with private sector groups to provide the support that is required. When it comes to accessing care, there are three routes in. You've got the primary healthcare access, so that might be going to your GP, your dentist, your opticians, your pharmacist. It's the first port of call when you're unwell. You directly access that service when you need it, and often they will make an assessment of your health needs while visiting. Secondary healthcare is often services where you're referred on to them. So you've been to your GP, they've made an assessment, they've recognised a health issue, they will send you to that setting for more treatment. So that might be sending you to a hospital to see a consultant, to see a specialist, get further tests done. That would be your secondary healthcare assessment. It is worth mentioning with hospitals, A&E is kind of somewhere in between. It's more of a primary. You go straight to A&E where they'll make the assessment and then pass you on to a ward within the hospital. Most people would go to their GP prior to needing to see a hospital consultant or surgeon. And tertiary care is often you've been to the GP, you've been sent to hospital, they've done tests, and then they refer you on to an even more experienced specialist. So someone specialising in a particular injury, or it might be a type of treatment you need, and that would be your tertiary healthcare provider. And last but not least, we've got private and voluntary. So we've talked about public health, public social care. It's just worth recognising that you do get the private sector involved here, where these are companies, businesses, where they are making a profit and they're providing their services at a cost of some kind, and they cover health and social care. So in terms of healthcare, you might see things like Bupa, Virgin Healthcare, or private sector doctors. They are providing healthcare for a fee. You also get private residential settings, so that could be nursing homes, residential homes, maybe even paying for counselling services if you can't access them through the public health bodies. The voluntary sector is slightly different. That's your charities that perform health and social care support. So healthcare, Macmillan Cancer Nurses or Marie Curie nurses, they are providing healthcare, but they're paid for through charitable work. Social care, Mind, Barnardo's, MenCap, the charities that provide a lot of social care support for people with learning difficulties or other health conditions. Again, that's provided through charitable donations. And then what I wanted to highlight here are just all the different settings involved in care. So hospitals, daycare units, hospices, residential care, domiciliary care, and occupational health. Now, I doubt you'll be asked a question directly about these. So, what is a hospital? What's a daycare unit? What's a hospice care? But it's worth recognising these settings, particularly because if you're familiar with the exam paper, often the short answer questions are always, settings, places where people can go to get support for a condition. So hospitals provide a lot of healthcare. It's obviously primary access, secondary referral. And if you're using a hospital as an answer, things like hospital, clinic are often too vague. The examiners like you to have a little bit more of a specific. So if you're saying someone with a mental health problem, they might go to see a mental health specialist at a hospital, or they might be sent to the psychiatric ward of a hospital, or they might go to a clinic, which would be a mental health clinic or psychiatric unit clinic. So try and be specific on the place rather than just say hospital, because it's quite a vague, quite a broad sort of setting. Daycare units, again, often these are sort of facilities people go to during a day. It's temporary. It's about stimulating them, providing social outlets, maybe education, training. It may be aimed at people with learning disabilities or people who are older. Hospice care is part of that tertiary. It might be end-of-life care, where people are being made comfortable because they can no longer be treated for their condition. And the big thing about hospice care is it is end of life. It's about quality. It's about dignity, empowerment of the person, meeting their needs, providing respect and dignity in death. Residential care is where you live in a unit, so it's a permanent residence of care. You get the nursing home care, which is medically supervised, more about medical care and nursing staff to make up the kind of carers. Residential care is more about you might need some help with personal care, washing, dressing, medication. But again, it's not like you're being medically treated, you're just being supported to take your medication yourself. But that's 24 hours, comes at a cost, but often it's an important form of care, particularly medical or social. And last but not least, you've got domiciliary care. You're getting care in your own home. This can be very sort of dependent on the circumstances, whether it's 24-hour day, whether it's once or twice a day visits. It might be helping you maintain independence by helping you go to the shops or providing equipment so you can be self-sufficient, or it could be more medical and you're being supported and helped with a more higher need medical condition. Occupational health at the very bottom there slightly doesn't kind of fit neatly in this point, but it's more about workplace support. So if you receive an injury in the workplace or some kind of distress or mental health concern in the workplace, they will provide an assessment about your suitability to return to work. And they will then provide you access to nurses, to counsellors, to physiotherapists. So it comes back to those primary care needs. So there's our first part, B1 of section B. As I said, mostly about the places where you can go to get treatment. Don't often see many questions asked about specifics of nursing or nursing homes, those kind of questions, or what is primary and secondary. But be aware of these places, the type of treatment they provide, because like the professionals in A1, A2, you will be asked where people can be sent for treatment, as well as who can provide that treatment. As always, I hope this helps. Thanks for watching and take care.